Welcome back to the Popkin Method, where we cut through the noise and get to what really works. In episode one, we got to know Dr. Popkin's journey. And today, we are tackling one of the most misunderstood and emotionally loaded health topics out there: weight management. Because here's the truth: weight isn't about willpower, it's about biology, hormones, lifestyle, and medicine. And this episode, we are going deep on how the Popkin method handles weight management, not with shame, but with science. So I know I am very excited to dive into this episode. Everyone has struggled with some sort of weight management at some point in their life. So I'm very excited to dive into this episode with you, Dr. Popkin.
I'm excited as well.
Let's go personal first. So, have you ever struggled with weight or body image personally? And if so, what did you really learn from that experience, either as a doctor or just as a human?
So thankfully, I've never had a weight problem, but for some reason, I just have an uncanny ability to relate to those that do. Likely because as a caring physician, I take the time to listen to my patients and I understand their particular cause of their weight gain. And I'll pair that with my years of experience in treating weight loss to come up with a successful solution. So it goes back to, listen to the patient. They're going to tell you, what pitfalls led them to gain the weight. And then you can work your way backwards to help them to lose it. And from early on in my medical career, I always understood the consequences of being overweight. With the health consequences, diabetes, hypertension, high cholesterol, heart disease. So it's more than just vanity. People want to lose weight because they want to look good, but really, weight has consequences to it. And diabetes is an epidemic in this country, and it's something that it can really be controlled with weight management. And so rather than treating the symptoms, I just always felt it was best to treat the cause. It's not rocket science. If you find out what the problem is, treat the cause, and you'll get a better effect. So I just apply the Popkin method. I just perform a good history and physical. I do appropriate lab testing, imaging tests, and I just treat the underlying cause with compassion. And most people respond favorably. Um, Most importantly, I listen to the patient, get to the root cause of their weight gain, and then again, you can work your way backwards and just put a plan in place to help them to achieve their weight loss goals. So for those that don't respond initially, though, I've got some really good tools at my disposal, including supplements. I like to use a lot of supplements in every part of my practice. In particular, for weight loss, I like probiotics, I like creatine, I like ashwagandha. I'll get to some of these in more detail later on. I love using peptides. I'm a big fan of peptides like Simorlin, Ipramorelin, CJC 1295. These are the peptides that increase growth hormone secretion. I'll talk more about them later. Very big into hormone optimization, either with supplements or with giving hormone replacement therapy. Because if a patient has hormonal imbalance, you're going to have a difficult time controlling their weight. And in particular, you don't have to necessarily to control somebody's hormones. You don't necessarily have to use um, bioidentical hormones. We can use supplements. I use a lot of different types of supplements for men and women. I'll use Tonkat Ali, Fagogia arrestis, boron, ashwagandha. That'll help patients to improve, to increase their own natural production of hormones. And for those that don't respond, we can give injections or creams for testosterone, estrogen, progesterone, DHEA, pregnenolone. But I look at everything. It's not just giving the patient a shot and hoping that they're going to lose weight. It's putting together an entire weight loss program.
Absolutely. And what do most patients seem to get wrong or they're made to believe about weight loss?
Well, I think the biggest problem is that people think that there's a single simple solution, and it's usually some diet craze or some product that comes out on the market. And, with social media, things are so heavily marketed, and you can make pretty much anything look believable. So I think the biggest concern is people think that there's a magic bullet. And In most cases, there isn't, and people have to realize that weight loss is big business, and it's subject to all the advertising tricks as in any other business. So, buyer beware. You're going to see some wonderful things out there. They look like they're going to be um, something that'll help you lose weight. So really, I want people to realize that, these companies, a lot of them just want to make money on the hopes and suffering of those that want to lose weight. And if it seems like a quick fix or like it's too good to be true, it usually is. So really, if you go back just to the practice of medicine with a really good blend of internal medicine and functional medicine, as I spoke about in my first podcast, and apply my method, you can usually find the right solution on the first try. And for those that are more resistant to weight loss, we can get more creative with the tools that we have, as I mentioned before, and I'll talk more about them later on during this podcast. People have to realize there's no quick, lasting fix for weight loss. If you want it to be long term, then you need to have a treatment plan that has to be comprehensive. It's not just a weekly injection. So put together a weight loss program or a lifestyle that you can follow long term, and you'll get lasting results.
Absolutely, definitely sounds like very sustainable change in life with all of these tools that you're able to provide and guide clients and patients along with. There's not a magic bullet or, in this case, magic shot, which we're going to talk about now a little about the GLP-1s. I feel like they're pretty much all over the place. Everyone has heard of them. Ozempic, Mounjaro, a name rings a bell to pretty much everyone listening, I'm sure. So let's talk a little bit more about them. When do you think they make sense? And what are some of the biggest myths that you've heard about them?
Well, you said it. These drugs are everywhere, and we're fully entrenched in the era of the GLP-1 medications, like Ozempic, which is semaglutide, and Mounjaro, which is tirzepatide. Mounjaro, tirzepatide it's a GLP-1 and a GIP agonist, so it has dual action. And what this means, GLP-1 meaning glucagon-like peptide-1 agonist, and GIP is meaning gastric inhibitory polypeptide agonist, meaning they mimic the peptides our own body makes to counteract the effect of insulin. So these are products that we produce. We just produce less of it, or maybe not as efficient of a molecule that's produced in our body, so it doesn't work as effectively. Now, it's important to understand how these medications work, and in a lot of cases, they are looked at as a magic bullet, and in some people they work real well just by themselves for weight loss. But unfortunately, as I'll talk about later, there's a price to that, in the sense that you're not only losing fat, you're losing muscle, and we're going to get to that later. So really, the main understanding here is that insulin is an anabolic hormone, and it stores calories in our cells in our bodies in an attempt to lower blood glucose. So it stores, it's anabolic, it's storing your calories, whereas glucagon, it's the opposite. It's a catabolic hormone. It helps to provide calories for consumption as energy by signaling the liver to break down stored glycogen, which is how glucose is stored. So the breakdown of stored glycogen into glucose and release it into the bloodstream to raise blood glucose. So it opposes the action of insulin. So you can kind of consider them, one is the gas pedal and one is the brake pedal. So they work against each other. And the GLP-1 and GIP agonist medications, these were originally used for diabetes, because of their properties for blood glucose control, boosting insulin release, suppressing glucagon production, slowing gastric emptying, meaning the food stays in your stomach longer. So it promotes a feeling of fullness. And all of these actions, they collectively contribute to both improved blood glucose and weight loss. And they offer other cardiovascular benefits as well, decreased heart attacks and strokes. So the medications, they are really good at not only getting people to lose weight, but in controlling other risk factors for heart disease and stroke and other ailments. The way to really look at these medications and what they're actually doing is, since obesity is really a disease of insulin resistance, meaning the insulin doesn't work as well. And insulin resistance is the hallmark of diabetes. And the GLP-1 and GIP medications help to decrease weight in most individuals because it works on that premise. and it helps people that have extra weight lose weight. It's not just diabetics that that it helps to drop weight in, which is why we're using them now in patients who don't have diabetes. So really, the myth is that the shot does the work, but that's completely false. And it really needs to be centered around a program that incorporates many different aspects, which we're going to talk about in this episode.
Absolutely. So everything you're saying, I can just, in my opinion, and someone who's went through it, is very, very accurate. So I struggled with hormone imbalance and took a GLP, and that is a big myth. The shot does the work is a huge myth. It's not true. There's a lot of other factors that do go into it. It's not this magic shot, but it certainly does help. So it's a great tool that is a resource to so many people now through proper guidance and nutrition and education with a provider for sure. It's not something you should just take on a whim either, and it will not just work. There's a lot of factors. And you have previously said that weight isn't just about food, it's about hormones, stress, sleep, and even muscle mass. So, can you walk us through that bigger picture?
Yeah, I mean, you said it. Obesity and weight gain is it's multifactorial, which is why the treatment has to be multifaceted. It's not just a shot, as I'm going to show in this podcast. The treatment plan it has to comprise all of the elements of the Popkin method to achieve success. And due to the nature of these medications being catabolic in nature, and thus causing tissue breakdown of both fat and muscle. The plan has to be to incorporate muscle maintenance as a mainstay of therapy. And that's really I can't stress that enough. These medications, because they are restricted calorie diets, you're going to lose weight. And unfortunately, if you don't do it the right way, you can lose equal amounts of both fat and muscle if you let it. And that's really what we're trying to we don't want to have happen. It's the loss of muscle. It's called sarcopenia. It's a name that you're going to start to be hearing in social media, and it's already being kicked around right now. But sarcopenia is the breakdown of muscle, and that's really the main problem with these medications if they're not supported by a program that prevents this. So it's a problem because muscle is the most metabolically active tissue in the body. It's what helps us to maintain our weight. So if you're taking a medication that loses helps you to lose fat and muscle, then really what you're doing is that in the end you're decreasing your body's ability to burn stored calories and ingested calories, and therefore you're going to eventually gain the weight back when you go off the medication. And you've probably heard of some of these terms. You'll hear Ozempic face and Ozempic butt and Ozempic fingers. People would lose so much weight their rings would fall off, or their body would become misshapen. And really, a lot of what this is you're losing muscle. So losing fat is one thing, but when you start to lose muscle, you start to lose the structure of your body parts, and that's where you get some of these odd terms that come in because people are actually losing muscle, and therefore they're changing their body habits not in a good way, but in a bad way. So it's because of the potential to lose muscle along with fat that the program has to incorporate all the different aspects of the Popkin method. And that includes lifestyle modification, diet, exercise, supplements, which I love using, as well as peptides, using the GLP-1 and GIP agonists, looking at hormones, and if needed, prescription medications. We'll talk about that. I try to avoid using prescription medications unless the patient needs, more help to control things like hypertension and diabetes, high cholesterol, thyroid issues.
That definitely sounds interesting. Would you mind explaining a little bit more or going into a little bit more depth about the ailments of your treatment plan or discuss them in more detail?
Yeah. So the elements of my treatment plan, as I discussed, and I'll rattle these off multiple times during the podcast: lifestyle modification, diet, exercise, supplements, peptides, hormones, and then prescription medications. So, really, anything that I'm going to treat starts with lifestyle modification, and in particular with weight loss, and it includes getting proper sleep, decreasing stress, sticking to a food program that makes sense for you. So we're going to modify your lifestyle. If you're not sleeping well, you're not recovering, you're losing muscle, you're going to gain weight. You're stressed, your cortisol is increased, it's gonna throw your hormones off, you're gonna gain weight. You're not following a good food program, obviously you're gonna gain weight. So lifestyle modification. Diet, super simple. We're gonna focus on what you eat. And some people it might be the Mediterranean diet, some people it might be low carb or no carb, other people it might be intermittent fasting. Everybody's different, and most people have tried things in the past. And if you listen to them, you ask them, "What have you tried? What has worked and what hasn't?" You can avoid a lot of time wasting by putting someone on something that they have failed in the past. And then exercise. This has to include resistance exercises to at least maintain, if not gain, muscle mass for the reasons that I mentioned. So also going into supplements, this is crucial. Again, supplements, I like to think of them as again, you're supplementing your diet, you're supplementing your needs with that you are not being met through normal nutritional dietary intake. So some of the supplements that I like to use, creatine is one of my favorites. It's one of the most studied supplements out there. It's extremely safe. And what it does is actually years ago, most people who are listening to this now, they probably would think of creatine as the muscle heads at the gym taking creatine to make their muscles swell and look bigger. That's no longer the case. Creatine actually provides energy for muscle and brain function, so it helps you with cognition. It helps with powering your muscles. It improves lean muscle mass, and it may improve testosterone and growth hormone levels. There's so many different reasons why creatine is good. Anyone that's listening to this, just Google the benefits of creatine and you'll wonder where it's been all your life. Protein shakes and essential amino acids as supplementation. That's to get the patient to meet their protein nutritional goals to grow and maintain their lean muscle mass. I'll talk more about this later, but really, what we're trying to achieve is you're supposed to have about a gram of protein per pound of ideal body weight. So let's say your ideal body weight is 150 pounds and you weigh 200 and you need to lose 50 pounds. You have to get 150 grams of protein throughout the course of a day. Most people probably don't even get half that. So that's one of the things we'll talk about later is proper protein intake. And of course, the peptides. I'm going to have an entire podcast episode about the different peptides, but in particular for weight loss, I like to use the growth hormone secreting peptides like samorelin, ipamorelin, CJC1295, which helps people increase their own production of growth hormone. And growth hormone does so many different things. Anyone that's out there that's listening, again, Google effects of growth hormone, and you'll see improved weight, decreased fat, improved muscle, better sleep quality, better skin, hair, and nail quality. There's so many different benefits of having growth hormone optimization. Some other peptides I like to use BCP157. Combine that with TB500. You've probably heard of that. It's called the Wolverine stack. These peptides are really good for people who have injuries. So BPC 157, it's a potent peptide. It's known for its regenerative properties, and specifically, it helps to heal muscles and tendons and ligaments, and even issues with the gastrointestinal tract. It helps to repair damaged tissues, making it ideal for recovery from injuries. It also helps you to recover from muscle breakdown. So again, we want to gain and maintain muscle. And it's also been shown to show really good promise in reducing inflammation, protecting against oxidative stress, contributing to faster recovery from muscle tears, joint damage, chronic conditions like arthritis. They really do a lot of fantastic things, which is one of the reasons I like this peptide in particular. And of course, the GLP-1 and GIP medications, they are peptides, right? Glucagon like peptide 1. They're peptides. Some of the other tools that I like to use, we talked about hormone optimization. Again, if your hormones are off, you're not going to lose weight. And in a lot of cases, having your hormones out of balance will cause you to gain weight and will lead to other significant problems as well. So whether I use enhancers like supplements, tonkat Ali, Fagogia, boron, ashwagandha, or if I give you direct replacement either through injection or cream, whether we use testosterone, estrogen, progesterone, DHEA, pregnenolone, we have to optimize your hormones for a good weight loss program. And again, prescription medications at the very end. My training from the Cleveland Clinic Foundation would have me born, bred, and brainwashed into prescribing medications for every possible ailment. And while it's important, again, you want to be able to use these medications only when necessary and at doses that are appropriate for patients and don't cause side effects. So again, people with blood pressure, diabetes, cholesterol issues, thyroid issues, of course, we're going to use prescription medications if they're needed. And hopefully, we'll be able to use the other modalities I mentioned to either decrease or eliminate those prescription medications if possible. So, of all the modalities I just mentioned, they all need to be blended using a really good combination of internal medicine and functional medicine, which is really the basis of my method. So as you can see, weight loss is complex and it won't be successful if you rely on just a shot to do all the work. You can see here, it's more than just giving yourself an injection and expecting these medications to do everything I just mentioned is one of the biggest myths that's out there. To think that a shot is going to do all the work for you.
Absolutely. So, how do you design a weight loss care plan that actually sticks?
Well, so as we discussed, if I'm going to put together a weight loss plan, really I focus on muscle. I focus on muscle gain and muscle maintenance, and that's kind of the mainstay of what we're looking for. And as I said earlier, the medications, the GLP-1 and GIP medications, they can cause equal amounts of fat loss and muscle loss if you let it. Now, remember that term I said earlier, sarcopenia, the loss of muscle, the breakdown of muscle. That's the problem here because these medications, if you allow them, they will cause your muscles to break down. You're losing the most metabolically active tissue in your body. And muscle is, again, as I mentioned, that's what is burning stored calories. It's your glucose reservoir to help decrease insulin resistance. It's your support system for movement, for balance, for function. So, using these medications necessitates the preservation and, if possible, even the gaining of muscle to achieve weight loss. So, you want to lose fat, not lean muscle, to achieve your weight loss goal. And that's why we really focus on muscle maintenance, muscle gain, increasing your protein, increasing resistance exercises. And for anyone on these medications, they really the hallmark of what I build around the treatment plan around these medications is to increase their protein intake to at least a gram of protein per pound of ideal body weight and do regular resistance exercises to increase their lean muscle. And I gave an example earlier. I'll give another example. Let's say someone is 225 pounds and their ideal body weight is 150 pounds. So they should shoot for a protein intake of about 150 grams, either, throughout the course of the day, either with food and or with supplements. However you get it. If you can get 150 grams of protein in a day from food sources, that's great. If you can't, that's when supplements come in. So again, for the plan to work, you've got to incorporate all the necessary elements that I just talked about, and don't think that the shot's going to do all the work for you. And really, all of these things should be incorporated into a weight loss program, and not expect the shot to be a standalone treatment for weight loss. So really what works is a combination. I'll rattle it off again. Lifestyle modification, diet, exercise, supplements, peptides, GLP-1 and GIP medications, hormone enhancers and or bioidentical hormone replacement, and if needed, prescriptions to help get to your weight loss goal. So it factors in all of these different things. Again, it's not just the shot.
A lot of people are confused by conflicting advice online. It can be overwhelming. There's so much information out there. Keto works. No, fasting is better. Actually, just count your macros. So, how do you help patients filter out that noise?
I apply my method. I listen to the patient. I see why they gain weight in the first place. If you talk to people, you'll see what their triggers are. You'll see what their pitfalls they got into in terms of what made them gain the weight. Most people have tried weight loss programs in the past. They've done various different things. So ask them what worked and what didn't work, so you can avoid doing things and duplicating efforts that had no benefits. And then I just use my experience to determine the best combination of modalities that I listed and get the right blend of internal medicine with functional medicine. and put together a program that is individual for that patient that they're going to follow long term. And in most cases, really I want patients to realize that weight management is something that you work on lifelong. When you start to deviate away from the things that keep you healthy, that's when the health consequences tend to build up. So, if you go back to your bad habits, you're going to gain weight. So I get the patient educated and engaged in their weight loss program. If they know what things they did caused their weight gain, then if they understand it, there's a good chance that they won't do it again. And remember, it's not just about giving the shot and thinking it's going to do all the work. In fact, most of the people that I take care of, I don't even use these medications, believe it or not. And the majority of these people, I'm not giving them medications at all. And if I do, I'm prescribing them for short periods of time just to jumpstart the weight loss program or to get a good amount of weight off of someone who has a lot of weight to lose. Again, that entire program, the GLP-1 and GIP medications are really just part of a program. And I just simply create a plan that makes sense from an internal medicine standpoint, from a functional medicine standpoint, and just help the patients to be consistent with the treatment plan, hold them accountable by having them, track their progress and focus on muscle gain and muscle maintenance.
And you mentioned that this isn't about extremes, it's about personalization. So, what does that look like in your clinic? And do you have a real life example that you can share?
Sure. So most patients that come to see me, whether it's virtually or in person, they have issues other than just weight that they want to lose, and you need to address those things for the weight loss program to be successful. So a lot of the patients that I see, they tend to have other medical issues like that. They have high blood pressure, they have insulin resistance, or diabetes. They have high cholesterol. Some of them may have heart disease, or at the very least, a risk factor for developing, or risk factors for developing heart disease. Some of them have hormone imbalances that can be worsened by excess weight and inflammation. Some of the older patients that I have, by definition, they're going to be deficient in growth hormone secretion and usually have some orthopedic issues like arthritis or maybe injuries that limit them from exercising. So it's not just the weight that you have to contend with, and then throw in some stress from work, which increases cortisol and further disrupts hormone production, causes weight gain. Mix in obesity related sleep apnea or stress induced poor sleep. And now daily fatigue is a factor. So people aren't exercising. Really, you can see that there are so many different issues to deal with that, these medications cannot be expected to treat them all. They're not a panacea for everything. So, really, you need what I do is I just create a custom treatment program that incorporates every part of my method, as I discussed earlier, including, rattle it off again, lifestyle modification. So I want to work on their wake sleep cycle, focus on sleep hygiene so that people are getting better rest, focus on their diet to make sure that they have an increased protein intake. Remember, 1 gram of protein per pound of ideal body weight to maintain muscle mass. Exercise in the form of resistance weight training to increase muscle mass, and then I'll incorporate supplements like creatine to increase energy, magnesium to improve blood pressure and sleep quality, omega-3 fish oils, which will help decrease inflammation. Love using pre and probiotics to improve gut health. And gut health is another topic that I'm going to do an entirely separate podcast on. Gut health helps with digestion, immunity. It also has mental health and cognitive benefits, and vitamin D3, K2, which has too numerous to count health benefits, including hormone support, improved muscle strength, immune function support, and of course the peptides, sermorelin, ipamorelin, CJC1295. These increase production of growth hormone, which again, look up the benefits of improved growth hormone production. You'll have increased muscle mass, decreased fat, improved bone density, better cognition, better sleep quality, you name it. I mean, growth hormone really helps a lot of different issues for people. Now I'll test my patient's hormone levels. We're going to shift over to hormones again, either using supplements to increase natural hormone production or giving patients injections or creams to replace them in a bioidentical fashion. And, last but not least, yep, prescription medications if needed to control blood pressure, diabetes, cholesterol, thyroid issues, any other things. Wrap this all up into a program. And again, my weight loss program is way more than a weekly GLP-1 injection. It's a delicate balance of internal medicine, functional medicine, and, really it just incorporates all the aspects I just mentioned with the hallmark of focusing on muscle maintenance and muscle gain if possible.
And you shed a lot of light on this already, but what do you wish that every person knew before starting their weight loss journey?
I mean, pretty much everything I just talked about, right? About how there are so many different elements to weight loss that it really explains why people who are not successful in losing weight. It really explains why they have the difficulties that they have because they're focusing on either one thing or focusing on the wrong things. So if you're not taking all of these different things into consideration, then your weight loss program is not going to be as effective. So really, just the fact that there are so many different elements to be considered, all the things that I mentioned that has to go into these programs, and just understanding that there's no one thing that helps. It's an entire program.
And if someone is listening to this right now, feeling hopeless or ashamed about their body, what would you tell them as a doctor who actually listens?
Well, the first thing I'd say is, there's hope. There's hope if you follow a multifaceted program and understand that, there's no one modality that's going to be the answer. And certainly a shot is not going to be the answer. I think there's so many people right now that have access to these medications, and you can go online and you can purchase them without even. I mean, you can talk to a doctor for 5 minutes or less, and then all of a sudden they're prescribing you these medications, really without understanding any of the reasons why you gain the weight. So in those particular cases, yeah, they're expecting the shot to do all the work. And you'll lose weight, you'll lose fat, and you'll lose muscle, and you'll put yourself in a worse position when you finish because you'll have less muscle than you did prior. So you're going to have more problems with weight management. So, everything I talked about today, most of these things are actually available without going to a physician. I tell my patients, you don't need me for this. You can modify your lifestyle yourself, right? You can change your diet. You can start to exercise. You can learn about supplements. You can focus on muscle gain and muscle maintenance. And in most cases, you can sustain lasting weight loss on your own. It's really the physician getting involved is helping to put all of these things together, helping the patient to understand these things. Yeah, of course you can go out and learn about supplements. There are so many of them, and to try to understand the biochemistry behind a lot of them, to try to find supplements that are actually worthy of purchasing, because a lot of these supplements they're fake. And if, in fact, there was a recent video I saw about the supplements on Amazon and how I believe half to three quarters of them are counterfeit. So they don't even contain the active ingredient that they say that they're supposed to contain. So how can you expect these supplements to work if they're not even what they say is on the label? So, again, buyer beware. So I think the physician that puts together the program, like for me, the supplements that I use, I work with specific companies that I understand their quality. I know their purity testing, and they have good reputation, so I can trust the products that they're putting out there. And for those that don't lose weight quite as quickly, that need a more aggressive program, yeah, there's so many tools out there. As I discussed, if you put in a comprehensive program, you'll get weight loss and longevity benefits as well.
And weight loss is one thing, but weight maintenance is where many people struggle. So, how do you help patients play the long game?
Well, the long game is, again, it's creating this precision, customized, comprehensive weight loss program that'll address all of the patient's issues, as I discussed, and will be sustainable. And that's really the main thing. So, identifying all the different contributing factors, putting together a program that the patient can maintain, not just for a month or 2 months, but something that they can incorporate into their lifestyle, something that they can not even consider being a diet program, but something that they just consider they're changing their lifestyle. The time to get down to your ideal weight, depends on a lot of different factors. It depends on your starting weight, how well you adhere to the program, how well you respond to the different strategies that I create for you. But really, again, it goes back to the focus on muscle maintenance. So if you focus on muscle maintenance and muscle gain, then most of these obesity related issues really improve drastically. And going back to the concept of insulin resistance, right? If you understand that insulin resistance eventually, it leads to obesity, and obesity leads to insulin resistance, and then those, if they're allowed to progress, can lead into diabetes, other problems that come from excess weight. So high cholesterol, hypertension, arthritis, different issues. So you want to realize that there's consequences to having excess weight. It's not just vanity. When you're younger, you want to lose weight because you want to look better. As you get older, you want to avoid the consequences of having excess weight. So I really think this is one of the areas in medicine where this program, my method actually treats so many different problems at once, right? You can treat obesity, diabetes, hypertension, cholesterol issues, heart disease, arthritis, sleep apnea, depression, anxiety, virtually any inflammatory mediated illness. So really, my method is a one-stop program for improving overall wellness and achieving true longevity. So if you're struggling with any weight-related issues and you're interested in seeing me, you can find me through my online functional medicine program. You can see me in the office if you're local here in Hollywood, Florida. You can click on the podcast link to schedule an appointment or message me. You can find me on any of the social media platforms, or you can email me directly, and they will provide my email link below. I look forward to seeing you.
This episode was personal because the struggle with weight and the shame around it is everywhere. But when you combine science, compassion, and a doctor who actually listens, something powerful happens. You feel seen, you feel heard, and you start to heal. And if any of this resonated with you, share it with someone who needs hope and subscribe so you don't miss what's next. And as Dr. Popkin said, you can see him through his online virtual functional medicine program anywhere in the country or the world for that matter. You can visit him in his Hollywood office, as mentioned, for a weight loss experience. And you can click on the podcast link on the homepage, thepopkinmethod.com, and message him directly for an appointment or send him an email at mcpopkinmd@yahoo.com. This is the Popkin Method, and we're just getting started.